The problem with lung cancer is not only it's common, but the death rate is very high. For example, if you have 100 lung cancer patients, only 10 to 15 will survive the lung cancer. That means only 10 to 15 patients will be cured of the lung cancers, and 85 to 90% of all lung cancer patients will die from the lung cancer. Lung cancer is the #1 cause of cancer deaths in Singapore. So we have 1,000 new cases of lung cancer diagnosed every year. You expect to have about 850 to 900 people dying from lung cancer in Singapore. What is the risk? How high is the risk of cigarette smoking to lung cancer? For example, if you compare a non-smoker to a cigarette smoker, the risk is about 10 to 15 times higher. 10 to 15 times is not 30%, not 50%, it's 1,500%, so it's very high. The common presenting symptoms are: 1, cough. But cough, you'll notice that cough is a common symptom. You have flu, you have cough, you have throat irritation, you have cough. If you're a smoker, you have smoker's cough. So actually we are looking for cough that has no obvious cause. We are looking for cough that's associated with other symptoms that may increase our suspicion of lung cancer. For example, if you have fever, you have a sore throat, you have the flu, you have the cough, we are not worried. But if you are a young patient, you're a woman, you never smoke, and you have cough, again, you're not worried. But if you're a smoker, if you're a male, you're middle age, you have cough that lasted for more than 3 or 4 weeks, that is associated with weight loss, these are the things that we look out for. Because the other thing about cough is the duration. A lot of cough due to those transient causes, irritation, due to the flu, they usually go off within 1, 2, 3 weeks. So we're actually looking for persistent cough that lasts for 3 weeks or more. For smokers' cough, a lot of patients, the smokers have cough all their life. In those of patients, we're actually looking for change in the nature of the cough. They may have coughed the whole life, but they may be coughing more severely, more often, the frequency. Blood in the sputum is always no good, but not all patients with blood in the sputum is lung cancer. Sometimes you cough too hard from flu, you can have blood in the sputum. If you have sore throat, infection of the throat, you can have blood in the sputum. You have tuberculosis, chest infection. So again, we are looking for symptoms. We are looking for combination of symptoms and not the single symptoms. If you look at lung cancer at diagnosis, at least 80% are diagnosed at least locally advanced and advanced cases. And that is one of the reasons why the results of lung cancer treatment is so poor. So one of the main things about managing lung cancer is early diagnosis. We want everyone to know that have a high index of suspicion of lung cancer, and we want them to seek medical attention early. So we also educate the health providers to have high suspicion for lung cancer, and for any patients who come in with symptoms that's suggestive of underlying lung cancer. Usually the first test is a chest X-ray. The chest X-ray, if the patient has lung cancer, a chest X-ray will be able to detect in the majority of the time, but not all. So in the patient that the chest X-ray is normal, but you have very high suspicion that patient has lung cancer. For example, this patient has been coughing for a long time. This patient has blood in the sputum, has loss of weight, is a smoker. Even though the chest X-ray may be normal, we still go on to the CT scan of the chest. A CT scan will give us very much better details of lung cancer. So the usual investigation is chest X-ray, but we'll proceed on with the CT chest if the chest is normal, if the index of suspicion is high.